Good afternoon, everyone. Hopefully everyone on Teams who's joining us online can hear and see. I'm John Goulston. I'm the chair of Kent Community Health NHS Foundation Trust. It's fantastic to have a full room of people at our annual members meeting and our annual general meeting. And I think I'd like just to start by thanking Age UK Ashford for providing this facility for us. We had a great marketplace earlier where lots of stalls from organisations within Kent and Medway. Had a long chat with the Macmillan Cancer desk with Anne there. And actually, it's these sort of venues that are so important in terms of health and care going forward. And actually the residents of Farrow Court, which is just sort of in front of me, behind this room, they're currently having their bingo. And they're actually polishing off the rest of the lunch that we've left behind as well. So it's so nice to be able to, rather than just being online for an AGM or just being in our headquarters, to be here. So welcome everyone. Hopefully you've all had sight of the agenda. There's a few formalities, but within the agenda, hopefully there's an opportunity to hear lots of what's going on, what's gone on over the last year, and what the future is from our presenters today. Just in terms of welcome, I'd like to thank and welcome, and we've had a number of changes on our board in the last few months. Mercia Spare, our chief nurse, retired at the end of March, and we welcome Caroline Bates as her replacement. Mercia has come back to help us with our staff academy, which is excellent. And then on the non-executive side, Paul Butler, who was chair of our Finance, Business and Investment Committee, left at the end of August. Nigel Turner, who's chair of our Charity Committee, leaves at the end of September. And Pippa Barber, who's in the audience, leaves at the end of November. And the first thing I'd like to do is to thank Mercia, Paul, Nigel and Pippa for all their work on the board over the last few years. They've all been on the board for a number of years. Pippa's actually been on our board for 8 years, and they've all done tremendous work. And I know that some of them haven't left yet, but I'm conscious that this is our opportunity at the AGM and the annual members meeting to thank them. So I'd like to thank them on behalf of the board. I'd also like to welcome, we have 5 new non-execs and associate non-execs who all started on the 1st of September, and they're in the room and on Teams. So Olu, Caroline, Andy, Farham and Marianne, welcome to all of you in joining in terms of joining our board. The final thank you I would like to do is to Carol Coleman, who I'm going to pass over to in a few minutes for the annual governors talk. Carol has been a governor of the trust for 8, coming up on 9 years. And as governors, Carol's been through 2 elections. This is her 3rd term. You're only allowed to do a maximum of 9 years. I've come across a lot of governors at Kent Community Health. Actually, in my new trust, Medway NHS Foundation Trust, come across more governors. I have not come across a more hardworking governor who is so supportive of our staff, of the patients and the families that we see, treat and support. So Carol, thank you. I know Carol doesn't leave, by the way, for quite a few months, but I'm conscious she won't be here at our next AGM as lead governor, and Carol's been our lead governor for a couple of years and done a fantastic job. So Carol, thank you very much. And it's just one thing that I thought, a couple of quick thoughts from me before I pass on to, we've got a film, and then I'm passing on to Carol. For Kent Community Health to be a great place to work, to provide good, high quality care with good outcomes, it's so important that the board sets the right tone in terms of leadership and culture. And I think sometimes we forget that. And it's really important. It's a really important part of getting an organisation to go forward. The other thing I wanted to do was to just read out a quote from Amanda Pritchard, who's the NHS England Chief Executive. And this followed the civil unrest that we had over the summer. And what Amanda said was, show in your actions that when we say we are having a zero tolerance of racism towards our patients or colleagues in whatever form it takes, we really mean it, even if it is difficult and uncomfortable. And I think that is a really important message, A, for our board, but B, for our organisation. That's all I wanted to say as way of introduction, apart from, are there any points of accuracy on last year's minutes that anyone wished to raise? If not, thank you very much, Gina and colleagues, for last year's minutes. We now have a film which just gives a snapshot of the year, and then I'm passing over to Carol.
What they did was they built me up as a person mentally, which was what they do for everybody. So, yeah, amazing team.
I like giving top looks. I think they're very caring and very considerate. They treat you as not just as a patient, they treat you as an individual, which I think is very important because we're all different.
They've just been amazing helping. He's almost running everywhere. So yes, he's doing amazing.
Most of our patients, they don't see anyone, for weeks, for months. They would like that extra time, time to, talk to them. They want to, apart from what you're going there to do, give us more time to assess other needs. We're practicing holistic care, so we want to, spend that time to, assess everything about the patient and to be able to meet their individual needs as well.
Yeah, I'm not a fast typer, so voice notes definitely works for me.
I am happy.
She's outstanding and unstoppable.
Reliable and first class. Admirable and brilliant. Big-hearted and one of a kind. She's skilled and she's our superhero. And she's our back boss.
I will try and keep this short, but as you know, I'm a bit verbose at the best of times. Can I say, and I have said it in the little video that's coming out, but I wanted to say it personally. This last 8.5 years, it's been an absolute privilege and a pleasure to have been part of KCAT HFT, if only in a small part. When I first joined, I knew nothing about the NHS at all, apart from being a patient and having received some fantastic care for a loved one who was terminally ill. And at that point, I thought, I've got a choice here. I can either help ECUFT or help KCHFT, and I'm afraid it was a bit of a no-brainer on that part. It's been eye-opening. You've just seen on that screen 70 different services. I didn't know that many NHS services existed, let alone under one community NHS Foundation Trust. And every single one of those services is delivered with professionalism and compassion. And the staff here are absolutely unbelievable. In my 8.5 years, I've only met a very small number of those staff, but not once have I ever met anybody that complained, even though I'm sure at the time they wanted to. Neither the patients that I've encountered, which have been numerous and many, and they've all been seeing those smiles, whether it's after coming out of the UTC or having been released from a bed to go home. It's just, well, it's heartwarming. So I'd like to say a big thank you to all the staff, the board, and patients and everybody else involved in this trust. And I'm gutted that I've got to stand down, as you know. It's something I can't do after 9 years, but they've been a fantastic 9 years. Hopefully I've put a few of those bits and bobs into a very weird video that you've got Joe to thank for that, on a very hot day, with a pile drover going on in the background, and we were rammed into a very small summer house in our new garden in Deal Hospital. But thanks for that, Joe, and I hope you enjoy it. Oh, can I just say one more thing? If you are thinking about becoming a governor, there are some vacancies coming up in the very near future. So hopefully in November or December they'll be advertised. Please consider it, because it might be life-changing for you as it was for me. This is my last year as governor for Dover and Deal, and my 9th. But it's also the 2nd year as my role as lead governor. And as that, I'm going to offer some reflections on what has been a fantastic year for the Trust. Firstly, I must acknowledge the first full year of Mairead's tenure as CEO. And throughout this year, we've seen some fantastic highlights, which I'd like to reflect on now. In May, we saw the opening of some new staff garden area at Deal Hospital, which was done completely by volunteers working really hard over what was a horrendous winter. But staff are now, or have taken advantage of it throughout the last 12 months and continue to do so. So a great thing. It was opened by Frances Tophill, farm garden as well. She was a local girl and has used the hospital many times when she was a child. This was followed in July by the whole Trust celebrating 75 years of the NHS. And I think we did it justice and proud, and the staff really got behind a lot of events that were held across the estate of the Trust. November saw the completion of 7 years hard work at Edenbridge Memorial Health Centre. February 24 saw the graduation of our first tranche of allied health professionals from our apprenticeship scheme run by our academy. This is ongoing, and we continue to expand the academy to try and future-proof the Trust with what has been ongoing staffing recruitment issues locally. March 24 saw the royal visit of HRH Duke of Gloucester, following in his father's footsteps, to celebrate 100 years since he had attended the hospital to officially open it. It was a fabulous day. The sun shone even this year, and I think he enjoyed himself along with other dignitaries. It's been an absolute joy. It's been a privilege, a pleasure, and it's a shame I can't carry on doing it for longer. I don't do it for the thanks. I do it to see a smile on people's faces.
Good afternoon, everyone. I'm Mairead McCormick, Chief Executive. I'm really glad I got a sneak preview of that because I actually felt quite emotional when I watched it at home. Wasn't that fantastic and a real great example of how to be a lead governor? Thank you, Carol. Absolutely fabulous. So it's really amazing to be here in Faro Court as well. And it reminded me of when I wasn't long in post, so that's just over 2 years. And Tracy Curley, the CEO of the District Council, had asked if I could come and visit Faro Court because she'd been trying to get this as a thriving hub and there was loads of opportunity. It was a winter night. Ali joined me and we seen the facilities and we talked about the art of the possible. And it's so fantastic because things have developed a lot since then and we've done so much together, but it really signifies to me the strength in good relationships and good conversations and going and meeting people in the environments where those communities should thrive. And it was a bit foreign for me because I'd come from an acute trust and the only waiting list here was a waiting list for the nail bar. Hopefully that has improved since I was last here. But it is a really good reminder of the services that we embed in our community and the power of community care. I'd like to start by saying a massive thank you. A thank you to everyone, our staff, governors, our board, volunteers, our partners for the work in the past year. Last year, we launched the We Care strategy in April, and it really signalled the change in the way forward. Because it was based on an improvement methodology, so continuous improvement. And we set 4 big ambitions for the future. And they're great ambitions because they really link in with a lot of the stuff now you'll have seen in Darcy report and setting the future for community care. But those 4 ambitions were to put our communities first, provide a better patient experience, deliver sustainable care and make Kent Community Health a great place to work. And they all sound quite generic, but when you break down what's within those, there are really meaningful breakthrough objectives within that. And they're designed to focus on making the biggest difference to patient care and to our staff in their working lives. More importantly, they were shaped by what you, the public, patients, clients, colleagues and stakeholders told us what really matters to you. As you'll see in our annual report and summary, we're really pleased with the progress we've made against those ambitions in our first year, and we're really excited about where we go next with these. So we'd like to take each ambition and give you some insights into the progress that we've made against those, and I'll get the help of my executive team to go through those and reflect on some of the accomplishments which were achieved by the dedication of our 5,300 staff. So I'm going to hand over to Ali, our Executive Director for Health Inequalities and Prevention.
Good afternoon, everyone. So, putting communities first. This ambition encourages us to think about people. People who live in the most deprived communities. People who live in groups who might not instantly understand the NHS, but like Carol said earlier, her journey of understanding the NHS has grown massively. Or other challenges that prevent people from accessing the care that they need. This can mean that they have poorer access, outcomes, or experience than others. This ambition aims to reduce those differences. Last year, we worked hard to improve how we record ethnicity on our electronic patient record and also other protected characteristics, so we can better understand the differences and improve support for isolated or vulnerable communities. Teams also worked hard to reduce the number of missed appointments, so to reach the people that we really need to see. To give you one example, each month in Kent, a staggering 2,500 health visitor appointments are missed. Our health visiting service acted to reduce these missed appointments, including sending text reminders, making appointments over the phone for people in targeted areas, and sourcing more accessible locations for clinics. 7,000 fewer appointments were missed during 2023 to 2024 compared to 22-23. 2,000 of these people were living in the most deprived areas. Let's hear on this short video from Assistant Director for Prevention and Public Health Services, Ginny Robinson-Bright, explaining a little bit more about what we did in health.
We recognised in some areas we had particularly high rates of missed appointments, and we recognised that not only does that mean that a family or a child hasn't received our service, but it also then has an impact on our teams in terms of their productivity and needing to reschedule those appointments and following up families, etc. So in terms of the work that we've done, we've really tried to look at the locations and the way in which we deliver our services. We've also spent a lot of time talking to families about and to children about how can we make our services more accessible and encourage people to attend their appointments in the first instance. And we've introduced things like text reminders to ensure that families have the opportunity to be reminded of their appointment, and also looked at ways in which they can easily change their appointment if something comes up. We all know that families have busy lives and things can get in the way of attending appointments. This financial year to date, we know that we have avoided approximately 7,000 appointments being missed by children and their families this year alone. And what that means in real terms is that we have been able to see those children, we've been able to work with their families to think about, are there any areas of support that they may need, and then arrange for that support to be put in place for them.
Thanks, Ginny. We also know how frustrating waiting for a service can be, and we know we still have very long waits for adult neurodiversity and community paediatric services. It would be wrong to not acknowledge this, but I want to briefly talk about how and what we're doing to try and tackle the backlog. Community Paediatrics set up a pilot to reduce the number of children waiting more than 52 weeks for an initial assessment, and all 385 were booked in by June of this year. We've also added a neurodiversity section to our online resource, The Pod, for families waiting for ADHD and ASD appointments to wait well and support their child at home. Our new Kent Family website, which provides advice, support and signposting for families and children aged 0 to 19, launched and was visited by more than 680,000 times in the first 6 months. I had to read that figure twice because I thought, seriously, that's an awful lot. The Darcy report, which has just been published, and the new government last week highlighted a new focus on prevention rather than cure, which is welcome news. We already know the power of helping people take control of their health and their lives, helping more than 5,000 people last year to quit smoking and another 15,000 benefiting from other interventions to help lose weight, get more active or feel more positive about their lives. There's always more to do, but we're on the right track. I'll hand over now to Pauline Butterworth, our Chief Operating Officer and Deputy Chief Executive, and Rachel Dalton, our Chief Allied Health Professions Officer, who will talk about our second ambition, better patient experience.
Hi, thank you so much for having me.
You too.
Hi, better patient experience. So Rachel and I want to run through some detail in relation to some of the things we've done over the last year to try and improve patient experience. This ambition is about focusing on what matters to patients and so that they can get the right care in the right place. This has been a key focus for us in the last year, reducing the number of patients who were in hospital beds when they didn't need to be, which we know is harmful, and developing integrated neighbourhood teams in conjunction with ALI to deliver better proactive care to stop people getting there in the first place. The Trust's frailty consultants played a major role in 2 clinical virtual hub trials, which saw 1,800 people diverted away from A&E between November 2023 and January 2024. Rachel?
Thanks, Pauline. Put that up a little bit. Thank you. In November 2023, a new joint health and social care roles and model called Home First Workers, support workers, were introduced to keep people safe and well at home as part of a partnership with Kent County Council. The team support people with local signposting and support so they can feel confident and safe in their own homes, and the program is now being expanded due to a successful rollout, and we're expanding that over this winter. I was particularly proud of the work taking place at our new rehabilitation unit at Westbrook House for stroke patients. I think one of our patients, Paul Robbins, summed it up when he said, "I thought I was going there to die, but actually I was really going there to learn how to live again." Paul described how the care he received at Westbrook House was really person-centred and unique to him and his specific needs. He even cites a lunch where he had his beloved pie and mash with cider vinegar turning into a rendition of and sing-along of My Old Man the Dustman. I'm yet to understand the link and how that happened, but he was very happy with the outcome. He also talks about a screening they did one night for the patients of Mamma Mia, which ended up with our stroke patients singing and dancing along to ABBA, which conjures up just perfect sights of what rehabilitation really should look like. Over the winter months, we worked with Kent County Council to test a new model of care by setting up 30 specialist rehabilitation and reablement beds at Westbrook House in Margate and Westview in Tenterden. This gave us the opportunity to test a new model of care and really think about how we deliver rehabilitation and reablement in a different way. We wanted to test how we could integrate models between health and social care and do something different. The pilot was quite successful and really informed our new way of thinking for future models. 9 out of 10 of the patients that went through those units went home with less care needs than when they came in, and nearly half went home without needing any additional external care at all, which is really quite remarkable and helpful for the resources of our system. This year, we've also started to create our case for change, to think about how we deliver care differently for our rehabilitation and for patients. This piece of work will now be picked up by our Commissioner colleagues, but I feel really passionately that it's the right thing to do. It's the right thing for outcomes for our patients and for us to be able to deliver sustainable care and models in the long term and in the future. And on that note, and talking about sustainable care, I'm going to hand over to Gordon Flack, our CFO.
Thanks, Rachel. Yeah, so sustainable care's got a few dimensions. So firstly, it is about living within our means, which I think we've done pretty successfully. But it's also about empowering our staff and giving them the right tools to do a good job, both now and in the future. And you saw from the film some of the exciting stuff we're doing in terms of technology. So voice recognition in a community team has allowed a release of 41 minutes a day per clinician. So it was about a third reduction on the time that those clinicians were spending to document care previously. The other really exciting one I'm keen on is about automation. So we've also started to use automation processes in some of our corporate services, particularly in HR, to automate things that were previously done manually by administrative staff. And it's both improved accuracy and speed at which that processing has happened, and it's helped with our recruitment process in particular, speeding that up. The other really exciting stuff is artificial intelligence. and we're just about to pilot the use of that in one of our services, community paediatrics, which allows a clinician to use it to listen to a consultation and automatically produce the notes. So one step up from just voice activation and recognition, it actually will produce the note and allow automatic letter production or population of a clinical record, clearly with the appropriate checks in place. So we're really, really keen to look at how that's going to work out. And then finally, the other aspect of sustainability is around having the right estate in the right place with the right condition to enable us to focus the right services in the right locations. And we're doing that in partnership with the wider health and local authority and voluntary sector. And the good example of that is the Edenbridge Memorial Health Centre, which was opened in November, bringing together community, primary care, health and wellbeing in a modern purpose-built building to allow, a real sort of step up in terms of patients thriving in their local community. So without our brilliant colleagues, we couldn't do any of this. So I'll pass over to Victoria Robinson Collins, who's our Chief People Officer, to give us an update in terms of where we've got to with that ambition. Thank you.
Thanks, Gordon. So this obviously is a really important ambition to me because of the portfolio that I cover, but also the meaning that it gives to our people, and that's the reason why many of us come into healthcare is actually about the impact that we have on people. So this is all about how we can help our colleagues to enjoy work, how we can make sure that their voices are heard, and that they feel that they can share ideas and improvements to change things that can make their job more rewarding. And often what you find is, we'll go out on exec visits and we'll hear things that our colleagues might say to us, oh, wouldn't it be great if? And those are the things that we really want to hear. They're golden because our people who are doing the services and are doing the work, they know where they can enact real change and where they can make a real difference. So that's the key really to our culture, and that's what makes it really golden to be part of Team KCHFT. To that end, last year we set out to improve our engagement and our staff morale even further, and we focused on the maximisation of our staff voice and wellbeing, and created a new staff voice model and a staff council led by our staff governors, and we increased the number of our staff governors to enable that to happen, and they work in a really collegiate way with our staff network colleagues and members of our staff side and other key representatives, for example, Freedom to Speak Up and other colleagues, so that we can really understand what are the knotty issues and what's really mattering to our people and how can we unblock those and help us to achieve our strategy. That's the key, is achieving our strategic objectives. And partly due to that, but also partly due to our fantastic communications team and the campaign that we ran around that to really help raise that engagement. We got our highest ever response rate to our staff survey last year, with 70% of our colleagues responding, which was a great result. We also, in the spirit of supporting our colleagues, because we know that our colleagues, in the spirit of living longer, our colleagues working longer, and often our colleagues are dealing with multiple conditions and comorbidities as colleagues as well as our patients. So to help with that, we introduced a wellbeing navigator, which is a tool to help our managers and colleagues find and navigate their way through the different health and wellbeing support that's available, as well as helping in terms of some of that signposting. And as a result of that, our network of health and wellbeing champions within our services almost doubled, to provide that local kind of conduit and touch point to really support our people. We additionally improved our appraisal process, and we really heard from our people and the fact that they wanted that to feel more meaningful to them. And we really focused on making sure that everybody had the time to think about their well-being, their development, their own aspirations, as well as reflecting on previous year's achievements. Additionally, we really heard that our teams were feeling tired and that there were some real issues around demand and capacity. So we worked to reduce the demand on some teams as well as tackling those workforce shortages. And I know there was a reference in one of the videos to our academy and the graduation of our allied health professionals as a first cohort. We've also grown our own in relation to our nursing colleagues as well, and we support many apprenticeships. We're one of the few organisations that uses all of our levy to do so, whether that be in clinical or non-clinical roles, to help them earn while they learn and obtain new career opportunities as a result. And I'm really pleased to say that our newest homegrown community nurses took the next steps in their careers as they came to the end of their 4-year apprenticeship, and we had a great time celebrating their achievements. They were the second cohort to successfully complete their nursing training, and that means that since the academy was established in 2019, we've supported 36 registered nurses to complete their training, which is fantastic. And we're now looking at how we can help to scale that up across the system as a really key partner within the Kent and Medway integrated care organisation to do that. Finally, but also really importantly, it's something that's really close to my heart. We've really focused on making sure nobody is left behind in our organisation, and that means we've made real strides in relation. Gosh, someone's very fast. We've really worked hard to make sure, and there's another one, there might be a high-speed chase going on outside. This is probably more exciting than me, but yes, I'll carry on and hopefully we can peek at that in a moment. We've really worked hard to make sure our recruitment processes are equitable and fair for all of our candidates, and to that end we've committed to the role of inclusion ambassador. So our existing colleagues are trained and supported to sit on interview panels and effectively act as a bit of a mirror and holding up a mirror to our recruitment panels to say, is this fair, is this equitable, could we do this in a fairer and more diverse and friendly way, and that's been really helpful, and they're all now recruited, they're trained, and they're actively helping our recruiting managers with those fair processes across the trust. I'll stop there. I'm sure you've heard enough from me, and I will hand back to Mairead. Thank you.
Thanks, Victoria. So, hopefully you will have seen our strategic ambitions are firmly aligned to the case for change that is highlighted in the Darcy report, which we're really excited about, and in particular that whole connection to moving work upstream into that space within prevention, and the focus on all things, primary prevention and secondary prevention, which we are very actively involved in and have got some very good foundations too. In these roles, sometimes you have really difficult decisions to make, and I wanted to say about some of the difficult decisions we've had to make this year. Many of you will know this, but we did have to make a difficult decision around a temporary move for our inpatient services in Sevenoaks Hospital due to a fire risk. So absolutely the right thing to do, the safe thing to do, and really important now that we look to the future for Sevenoaks and build what we believe is right for that local community with partners and future-proof health facilities. So a really good example of when we talk about, if you've read the highlights in the Darcy report, when we hear about infrastructure and modernising health facilities to improve outcomes and move with models of care. So we're in the process of also looking at how we rehabilitate people. And for those that are interested in the world of rehabilitation, obviously led by our chief AHP, clearly how we've rehabilitated people has changed and needs to change fundamentally for the future. So we look to evidence for this. We look to evidence from other countries that do this much better than us, that invest much more in rehabilitation. And why would we do all of these complex procedures, etc., and do all the good work and then not rehabilitate people properly? So watch this space, very much part of our work going forward this year. Our relationships with partners are absolutely critical, and we spend a lot of time on this. It's important to develop good relationships, but I firmly believe that collaboration is at the heart of improving outcomes and also for sustainability for the future. So we've done a lot of work through our provider collaboratives. Loads of really good work that you've seen today has happened through those collaborative arrangements. And it's safe to say the financial envelope is just getting tighter. It's getting harder and harder. But we really embrace the 3 strategic aims set out by the government, which is to move from hospital to community. We do a lot of that already, but we need to scale that up. So we're really excited about that because we know how to do it. Analog to digital. Gordon's already mentioned some of these, but we've got really good foundations. So let's just keep scaling that up and enabling ourselves and freeing up time to care. And then Ali mentioned treatment to prevention. So really, really important to get upstream and to get in early. And finally, I believe that I work with incredible people. Carol's already said it. There are incredible people in our organisation and with our partners. I can't thank them enough for all that they do, but led by an exceptional executive team. I am really, really lucky. I am surrounded by an exceptional, talented executive team with the right values to deliver what you've just seen in our ambitions. So thank you for everything that you do. And finally, thank you to John, the chair, who supports me tremendously throughout the year and keeps me sane. To our board, thank you for your support, your challenge, really welcomed, and to our governors, and especially thank you to Carol this year, considering the year that it is. So thank you.
So we've got a little video. We're going to do that first, or yeah, let's do that first. Let's watch the video, shall we? Yeah. Leave that one up with the donations page. Yeah. So another successful year. So it's the 13th, and I've been here for all 13 of those years. So really proud that we've managed to achieve all our financial duties yet again. We've had our external auditors say our accounts are prepared properly. They've also said we've got proper arrangements to deliver value for money and efficiency for our public. We've got our internal auditors who's concluded that we've got reasonable controls in place, effective risk management and governance. So tick in the box, we've pleased our auditors. NHS England also rate us in what's called segmentation, a top segment, which means they don't think they need to help us, which is good. And they assess our quality of care, use of resources and leadership, amongst other things. So again, tick in the box with NHS England. We did end up with a surplus, which was larger than we anticipated. And that was partly because there was a national change in policy and we received some extra funding at the end of the year. So effectively, a planned deficit from the ICB was covered with additional funding, and we got £6.5 million. So if you take that into account, then our underspend was smaller than is shown in the headlines there. But it's still a reflection on that we're not spending all the resources. So we do have vacancies, and that in itself isn't a success. So we do need to continue to improve that. As part of delivering a financial plan, we also have to deliver savings year on, year out. And this last year, we saved £14.4 million in terms of efficiencies and changes in the way we work. And the prospect is that we're going to have to continue delivering savings at that level going forward, so approximately 5%. But I think the prospects for community services are bright. As Mairead described, the sort of direction of travel, government policy is that we have got the solutions to some of the intractable problems that we see in some of our health and social care systems. And that will mean more interesting careers, which will help, I think, generate more retention and more people want to come to work into community. So that will, I think, eventually reduce our vacancy factor. In terms of capital, we spent £4.6 million if you exclude Edenbridge Health Centre. And that included some additional monies we got from NHS England to support our digital offerings. So we got £1.7 million for putting in a new pharmacy system and improving the links between our IT systems. So when you discount that from the total sort of capital available to us, we've got a very modest amount for the sort of huge demands we've got. And we do have a large sort of backlog maintenance in our estate. So whilst we celebrate the sort of Edenbridge Memorial Health Centre, there's insufficient resources for us to roll that out across the board. We can't repeat that many times in terms of that level of investment. So we do need to be more innovative in terms of how do we use the wider public estate and work with partners in terms of other solutions. And then finally, our charity remains active. And thank you very much for all that activity that's helped to generate funds, which helps us do those extra little things that we couldn't otherwise afford. Thank you.
Thank you very much, Gordon, Mairead and the execs for your excellent presentations. We now come to a formal part of the agenda where we're looking for our members to adopt our annual report for 2023-24, which you can find on electronic form on our website. He says, hopefully, nodding, that's good. But also, if you would like a hard copy, we've got a full hard copy, and we've got an easy read small copy. So if anyone who would like paper versions of the annual report, we've got some in the room, I think, on the left-hand side, my left. But please do help yourself, as it were. So this is a request. Is everyone happy that we can adopt the 2023-24 annual report and annual accounts? So this is to the board and to governors. Yes? Thank you. Thank you. While we're doing that, this is an advert. One of the things that we have in our trust, being a foundation trust, is members. All members of staff are a member of our trust, unless they like to opt out. But members of the public are welcome to join. And we have 1.9 million people in Kent and Medway, but we only have about 8,000 members. So there's a real opportunity for us to grow our membership. And the membership elect their local public governor. And there's a public governor for each of the local councils, matching each of the local councils. And it's great to see some of our governors here. And I think it's just something that it'd be interesting we need to do more in terms of events like today and engage with our governors and engage with our members in particular. So that's my request for today, is let's think about how we can grow the membership and just look at engagement events like today. The second advert is that being a key employer in Kent and Medway, there's a real opportunity to employ local people in a whole variety of roles, from professional, clinical to non-clinical roles, to corporate roles, to support services roles. We have a great academy which we need to build on. It's got 200-300 members already, all on different academic pathways. So this is one of our recruitment brochures. And I'm pleased to say we've got a new governor who's the head of an academy. And I think that gives us, and a new governor from Canterbury Christ Church University, two of our appointed governors. And I think that gives us, again, an impetus to actually look at how we can, I'm allowed to use the word, market our services, as it were, in terms of career opportunities for local people. So I think that would be great. So they're my two adverts from today. And I think with that, Julia, we have finished all our formal business.
We have. We can go to questions
Which that
now.
takes us on to questions for members of the public. Sorry, I've left something out. Mercy's going to tell me off now. Thank you, Mercy. Thank you very much.
Mercy.
It's what happens when you look up and not down at the agenda. Thank you, Mercy. So we had a task and finish group. Many thanks to Mercy, Pippa, and many of the governors for working on updating our constitution, which hadn't been updated for a few years. So we've got a number of changes to our constitution that have gone through our Council of Governors. So today, the second thing we need to do is to adopt the new constitution. So again, Board of Directors, but particularly Council of Governors, are you happy to adopt the new constitution, or the refreshed constitution? Thank you. With that, let's move. Thank you, Mercy. Thank you very much. Let's move to questions. And shall we first do any questions from anyone in the room? And then we'll go and see if there are any questions on Teams. Joe has a mic, so it would be really good if you could ask your question into the mic, if anybody has a question. One over here, Joe, second row. The good news is, when someone asks a question, the answer comes from someone sitting down there.
Yeah, okay. Yeah. On page 18 of the community booklet, it says all services with waiting times of more than 12 weeks have a plan in place by October 2023. Well, I disagree with that. I've been waiting over 18 weeks to see somebody in a hospital. So I think that's wrong.
Could you take it to point?
Thank you for that. Did you say 2023?
That's what it says.
Yeah.
Oh, from the annual report.
From the annual report, yeah. So that's slightly historical. We do have a number of services that are not meeting their targets, but there are plans in place for a trajectory to meet the target. But you're absolutely right. There are some services that are not meeting an 18-week or 12-week standard, depending on which one they are meant to achieve.
But it also depends on which service you're referring to as well.
Yeah.
Audiology.
Yeah, so there are weights within audiology. Yes, you're absolutely right. I need to look at the booklet.
I think that says that they have a plan in place. Sorry. I think the report says that they have a plan in place, not necessarily that they've reduced the weight, but we'll come back to it. We will look at it.
Yeah.
Other questions from members?
Good afternoon. My name is Janetta Warwell, and I've been a resident in Ashford for over 55 years. I'm a member of the Trust, and I have been involved with the patient experience groups over the years. I've got a question relating to children and dental services in the community. Having practiced in public health and prevention as a health visitor for many years, in my time, preschool children attended the community clinic, dental clinic, for their dental checks. Is that service still available now? And according to the national news recently, there were preschool children who had dental decay, and the parents could not find dentists, National Health Service dentists. So what is the situation in East Kent for children preschool age? Because dental services, are the parents having to pay to go to the private dentist? Because there are many dentists in the community who are not taking on NHS patients. I would like that clarification, please.
Thank you very much, Mairead.
Yeah, so we don't actually provide general dental services. We only do specialist dental services. So we're not in a position to answer that from a trust perspective. I think that's most definitely a question for the wider Integrated Care Board or via the East Kent Health and Care Partnership. So yeah, we only provide the specialist dental services. Those are not services that we manage. Yeah, so there are many different forums that we can help you with, and I think let's spend a wee bit of time with you and signposting you to the areas where you could help influence this. As I say, it's not services that we provide, but we can definitely point you in the right direction to help who to have the conversations with and to become part of that sort of patient user representative group.
Oh, thank you. Thank you very much.
Hi, I'm a health visitor. So we offer the 1 year and 2 year development review, and part of that is we explore dental health. It's the sad truth that there's not enough dentists to sign up to. We're lucky I'm in Thanet. We're lucky we do have one that will take on and has been taken on for a while in a local community, especially children. But we also have different avenues, so like the dental line and things like that where we can get emergency. But you're right, we've got things like the oral health bus that goes and tours around and comes to different events to kind of promote that dental health. I know they go to schools as well, but yeah, that's where the points where we kind of check in. And to be honest, we're talking about it at the 6-week check just after they're born as well. When they get teeth, start brushing. But yeah, in terms of, yeah, like Mairead said, we don't provide the service, but we do definitely follow that pathway, follow them through and signpost where we can.
Thank you very much, Annette, for the question. Any other questions in the audience? If not, are there any questions? No, we haven't got any questions on Teams. I'll just pause just in case anyone's got a question they would like to ask. No, I thought Joe was going to ask a question then as a staff governor or as a member of staff. I'd like to thank everyone for giving up their time and making the time and effort to come and join us today. It's great to see 50 or so people here at Farrow Court. So thank you very much. I'd again like to thank Age UK. And I think the final thing to say is our organisation, we know we're not perfect. You've heard a lot of good things about the work that we're doing. But like all organisations, no organisation is perfect. But what's important is that we acknowledge where we need to do better, and we get on and try and do something about that. And Mairead, the executives, and I know our clinicians and managers, that's what they want to do. Gordon mentioned some really good examples of quality improvement projects where our staff really want to improve what we do and what the offer is to the people that we see and serve and treat. And that's a tremendous accolade, I think, to our staff, that they just have that in their minds all the time. What can we do differently? What can we do better? And I think that's the thing that really makes me proud to be the chair of Kent Community Health. So thank you very much for being here today, and look forward to seeing you all sometime soon in the future. Thank you.